Behind me is the beautiful countryside of New Zealand. This is a message to carers, to those looking after the chronically disabled. And I'm talking about disabilities involving cerebral palsy in the younger ones, after a stroke in older people, or after a head injury. I'm talking about multiple sclerosis or motor neuron disease where there's paralysis of the muscles. And I'm also talking about dementia or in older and debilitated people. To care for them is a real challenge. We estimate that about 3/4 of patients who has got swallowing difficulties, or we call it dysphagia, goes undiagnosed, and we think that carers is the key to identify them earlier. You guys play a great role in looking after them 24 hours a day on the coal face, day and night, often sleepless, often with a lot of trouble and very little reward. But you're the people who can actually pick up the disability early, and I'll explain to you what I mean. In the later stages of swallowing difficulties or dysphagia, it's easy. The patient usually can't talk, or he's got very slurred speech. He often choke on the food, and when he opens his mouth so that you could feed him again, there's still some food sitting there. He might have had pneumonia, might have been in hospital because of it, and it's usually easy to know they can't swallow properly. In the early stages, it's more of a challenge. Look for somebody that's just developing a difficulty to talk. He might have slurred vision, struggle to pronounce his words properly, speak slower, and might not want to talk the whole time, where he used to talk quite a lot. He might choke easier, might have had unexplained pneumonia. If he opens the mouth, there might be a puddle of fluid, saliva just behind the lips, around the teeth. He might even drool a little bit of saliva. That's the patient you want to bring under the attention of the medical people, the doctor, the nurse, the speech pathologist. The reason why we want to diagnose early is because we want to prevent pneumonia because of aspiration or breathing the food in. We can prevent malnutrition, dehydration, and we might be able to increase quality of life by introducing rehabilitation processes. And you can help us to identify these patients early. Finally, to you carers, we want to say thank you very much, because you're doing a job that very few of us is prepared to do, and very few of us can do, and that's looking after the chronically disabled in very challenging circumstances with very little thank you and very little reward. We salute you for your commitment.